everyone. Thank you so much. We're just about ready to begin. We have all our panelists on board and people are still entering the room. Thank you so much for coming. And I want to start by thanking Hofstra for working with us to create this panel series or this forum series. And I would like particularly to thank the dynamic duo of Joanna and Brittany in university relations. They made this, I hope it will work seamlessly. And if it doesn't, it's my fault, not theirs. They've done everything possible behind the scenes to set us up. And I'm really grateful to them. This forum is organized by Hofstra Labor Studies and the Hofstra Center for the Study of Labor and Democracy in partnership with two Long Island organizations. The first, both of which I've had the pleasure of working with before, Long Island Jobs with Justice and A.L.L.O.W, Advancing Local Leadership Opportunities for Women. And I'm really thankful to them for partnering with us on this initiative. This is the first of a series of 3 fora. It will be taped and will be available to view at your pleasure and leisure on YouTube. Also, the resources that you hear mentioned here today, many of them will be provided to you in the chat. And they also will be available probably tomorrow at the Hofstra University Labor Studies website. So if you are looking, if you don't catch them in the chat and you want to consult with them in the future, you can go to www.hofstra.edu/labor studies, and we will provide the links for helpful resources that, that are mentioned today, and probably some other things that come up after this forum, ideas that people have. And please feel free to send us things if you think they would be helpful for people to have. As I mentioned, this is the first in a 3-part series. Workplace safety. What is workplace safety? Who is responsible? The series title is Reopening Long Island and Building a Fair Economy. The second forum is on July 7th at the same time. It's a Tuesday, July 7th at 2 p.m. And the subject for that forum is about the challenges of working from home. So issues with care work, issues with managing time, and all the other things that come along with working from home, which appears to be the new normal and possibly will be in the future for many of us who are fortunate enough to be able to do that. But it is not without its challenges, and we will be addressing those. The third forum, we have not yet set a date. That will be on immigrant workers, and we encourage you to attend the next 2 or to consult with YouTube, and we're really grateful to be doing this, and it's important work, and I'm so glad to have these great partners to do it with. Before we begin, before I introduce the panelists, I just want to say a few words about the moment that we're in. And I'm feeling a little bit emotional about that. So here, our intent is to focus on suburban labor organizer and building worker power on Long Island. But labor, the movement, and obviously the struggles of working people, it's a local, a regional, a national, and a global movement, and always has been. And it's a movement for everyone who is a worker, whether you're in a union or not. And the cornerstone of the labor movement from its very beginnings has been solidarity, right? One for all and all for one. And everyone should be welcome in the labor movement, and we should all stand up for each other. We do not always practice that. We have not historically always practiced that. We have been discriminated against as women. We have been discriminated against as immigrants. We have been discriminated against as migratory workers, as Black workers, as non-English speaking workers. And we need to do better. We can do nothing on our own. That's what the labor movement teaches us, that divided, we are vulnerable and weak, but united, we are invincible. And so we must practice. We must embrace solidarity as a concept, but also as a lived practice. And we must link arms and struggle together to make a better world. And so all of us here, the organizers and the panelists, and I am sure all of the attendees, we believe in that, in the concept of solidarity. We practice that concept. And so together we mourn the loss of George Floyd. We mourn the loss of every person who was killed needlessly by violence. Our hearts are heavy for the burden that our Black brothers and sisters carry with them every day. We do believe in the motto that an injury to one is an injury to all. This is a powerful labor slogan. It is a slogan that should inform all of our lives. And I am trying my best to live by it, and I know that we all are. And I just want to call that out, that that is who we are as a labor movement, and that is who we should always aspire to be. And so with that, I will introduce our panelists. In no particular order, they'll be speaking in a variety of different orders, but here they are. Marina Jabsky, who's an industrial hygienist with the New York Committee for Occupational Safety and Health, otherwise known as NYCOSH. Alexandra Howell, who's an attorney at the law firm of Archer, Byington, Glennon, and Levine, and also the founder of A.L.L.O.W. Nikki Kateman, who's an organizer for Local 338, to be RWDSU, UFCW. They organize retail workers. So we're thrilled to have Nikki with us, as well as Alexandra and Marina. And last but absolutely not least, Halasz, who is the Executive Director of Long Island Jobs with Justice. And again, we're thrilled to have all of the panelists with us. My colleague, Greg DeFreitas with the Center for Labor and Democracy is also here. Also, other colleagues, Richard Kubek and Diane Cantave from Long Island Jobs with Justice. Thank you so much for coming. Greg will be moderating the chat with me. Here's what we're going to do. I'm going to pose some questions and pitch them to panelists. Panelists, if this question is not pitched to you, but you have something that you want to say, you are absolutely welcome to chime in. And after they give some brief answers to the questions, provide some information, we will hold a Q&A, and you are all invited to participate. I will be monitoring the chat, as I said, with Greg DeFreitas, and we will do our best to get to all the questions. Please stay muted, and this way we don't have feedback. And please put your comments, your questions in the chat section, and please address them to either to Greg or me or to all, so that we make sure to see them. Okay. So without further ado, I will begin with a question for all of the panelists. And what you're going to see, by the way, is you're going to see speaker views. So whoever is speaking will be on your screen. Let's hope that this all works. This is our first one, but I think we've got it. All right, so the first question, and I'm going to start with Nikki, but then we will just go through all the panelists, is can you give us a sense of what your work life was like before the COVID-19 pandemic and how the pandemic has changed things?
Sure. Hi, everyone. First, let me thank Hofstra for having me here. I'm very excited to be part of this panel with, quite honestly, a lot of people I work with regularly, so it's like being with friends. So thank you for this opportunity. So I'm the Political and Communications Director of Local 338. And so prior to the pandemic, I was based in Albany, quite honestly, working on a number of different legislative and budgetary items. So my day was spent walking in physical, literal and metaphorical circles at the state capitol, and things changed very quickly. I obviously am working from home. A lot of the work on legislation and quite honestly budget items took a pause, and my work shifted. I oversee the communications, both in terms of what goes out to our members and what goes out to the public. So the nature of the communications we were sharing changed very dramatically, changed in frequency, quite honestly, but also the amount of contacts we got from reporters had also increased because essential workers are suddenly very sexy, and Local 338, our membership is primarily essential workers, both in terms of food retail, pharmaceutical retail, healthcare, human services, and also medical cannabis. So we have a wide range of industries. But a lot of my work also shifted in terms of, I continue to talk to elected officials, but it was in terms of, what can we do to make sure people's health and safety is met? How are we getting PPEs out to people? We need to find PPEs. So a lot of my work, the actual setting changed, probably the amount of phone calls changed, but really the urgency of my work took on a whole new world because of the intensity of making sure people were safe and healthy.
Okay, great. Thank you. Thanks, Nikki. Next, Alexandra.
Hi, thank you. Also, I just wanted to thank Hofstra for having us here. And before I answer your question, I also just want to talk about something that I think we all need to be talking about now. So I think that this is the moment to acknowledge that racial injustice is inextricably linked to economic injustice, and that this pandemic is certainly no exception. We see this in the Black communities that are disproportionately affected by the economic toll and by the health toll that this pandemic has had. I also wanted to mention that the New York Times editorial board reported on May 18th that 125 people had been arrested by that time for coronavirus related offenses, and that 113 of those people were Black or Latino. Of the 374 summonses issued between March 16th and May 5th, 300 were given to Black and Latino New Yorkers. So I think that the conversation about reopening the economy is tone deaf without a conversation about policing, police brutality, economic injustice. I'm asking myself every day, what can I do? What are we doing to change our system? And I think finding ways to recognize the fight for racial injustice and inequality starts with each of us as individuals and as allies, calling out privilege, recognizing privilege, acting, participating, most importantly, voting, and even more important than voting is listening. I think we need to be having conversations with our bosses, with our friends, with our colleagues, with our children about the uncomfortable conversations that need to be had about racial injustice. And I ask myself, if we're gonna emerge from this pandemic any different, or are we just going to be a masked version of exactly the same place we were before? So I'm asking myself these questions and standing in solidarity with the Black community today and every day, and just looking to find ways to put my words into action. So, and with that, I'll answer your question, Marianne. My work life, as Marianne said, I'm an attorney. I represent workers and unions, labor unions. My work life before was hectic, but now my work life means that I'm working full-time, home with 2 children. I have 2 babies, and I know a lot of moms do. Relying heavily on my village. My mother-in-law was the first person to sign up for this, so thank you, and she's been so helpful with our children. She's also working full-time, and so my legal work has changed a little bit. There's a lot of severance agreements that we're looking at. A lot of employees and unions were affected by this, and a lot of employers were doing the kinds of layoffs and discriminatory layoffs that they were doing beforehand, but now they just have a good legal excuse to do them now. So that's how my work has changed. In addition to, you know, failing at being a full-time mom and failing at being a full-time lawyer, I am also looking at all these pandemic issues and the impact that they've had on unions and employees.
Thanks, Alexandra. Ani?
Yes, thank you, Marianne. Thank you, Hofstra. I think both of you gave really powerful introductions, so I don't want to take up any more time, but I absolutely agree that if we are not looking at the intersections of inequity at a moment like this, then we are going to be failing our world, even more so than perhaps we already were before. So very vital. For me, I would say that as a community based organization that works in deep relationship and contact with our people, where we depend on mobilization as the root of our power, being socially distanced out of the halls of local government, out of the stores in which we speak with workers, away from the courts where we are supporting immigrants. It's been very difficult to maintain those deep connections. And if anything, it's sort of put us into this headspace of really seeing the systemic inequities for what they really are, and struggling to figure out how exactly we can break down these systemic structures at a moment where our access and our movement is restricted so much. So I would say it's more of an existential crisis that we as community-based organizations are going through, and trying to figure out how we are actually mobilizing at a moment when we cannot move around as much as we want to, and we cannot be in contact. But I also see this as a really remarkable moment where we can actually sit and pause a bit. So really trying to, compartmentalize the grief and the stress and the struggle with the sort of beauty of being able to pause and reflect and really see things for what they are. So both stressful and I think very sort of enlightening and beautiful at the same time. And I too am a failing full-time executive director and a failing full-time parent. So I am right there with you, Alexandra. I also am home with my son for a good portion of the week. So it's been really, it's been an interesting process, and I definitely feel for all of those working parents out there who are trying to work and still raise their children at the same time. And I look forward to the next presentation that we're doing, because I think it's going to hit home for a lot of people. So pleasure to be here today.
Thank you, thank you. And then last but not least, Marina.
Thank you, Marianne. And also my own thank you to Hofstra for having us and for the invitation to be here. It's really an honor to speak with everyone. And echoing Ani, I think Marianne and Alexandra gave absolutely excellent introductions and summaries to what's going on in New York, what's going on worldwide right now, what's going on in our country. And I also don't want to take up additional time and rehash what was already been said, but you know, if we're not going to talk about what's happening or what has to change now, then you know, when are we going to do it, right? So if we, you know, we can't address worker issues, we can't address safety issues without addressing the systemic injustices that are inherently built into our institutions. So I think it's absolutely crucial that we deal with these right now. I'm going to take this moment also to apologize for any background noise you hear from me. I've had street construction happening for the last few months, so if you hear any hammering, they're breaking up the concrete. I'm sorry. For my work life, I'm an industrial hygienist, so a lot of my pre-COVID time was spent doing either on-site visits or on-site training relating to health and safety issues that are workplace specific. So some of my time was spent in our office, and some of my time was spent running around New York, whether that's a city or out into Long Island or Westchester County, looking and crawling around people's workplaces, interviewing people, very face-to-face work, very not at all distanced work, very much let me touch everything that's happening in your workplace type of efforts. And of course, now that is very different. So we are at this point working 100% remote, everyone at NYCOSH. We have all of what used to be our in-person trainings are now being conducted through Zoom. The site visits are gone, right? So no one wants to see me at their workplace, and they're also not at their workplace right now. So that's been put on hold. And the content of the work we do has also changed, right? When I used to do site visits, it was for any and every issue that, that people had. And now it's pretty much all COVID all the time. It's changing a little bit, but for the last few months, all of our trainings were COVID related. All of the questions I used to get, technical assistance, was how do I configure my space for, to deal with this pandemic or to prevent infection or what have you. A little bit now, since there's talk of reopening, I'm starting to get a trickle of questions about, all right, well, how do we move forward from here? And people are becoming interested in, the regular trainings we have been offering again, but it's still a gradual shift in that respect. So that's me, and thank you so much.
Well, speaking of reopening, Marina, I'd like to toss our second question to you. So as we talk about reopening, those of us who are not already working, I want to be sure to make explicit that there are a considerable number of people for whom work never closed. Those of us, though, who either are working or are looking at going back to work are concerned about the safety of our workplaces. So where can we go to find the safety standards for different industries?
Well, thank you for that segue, Marianne. All right, so I'm gonna start this at a top to down kind of level. And this is how I start when I'm looking for a search, and certainly other people have different methods, but I'm going to share with you mine, right? So in terms of what the actual protections that are existing already are, and it is worthwhile to take a note and say that a lot of what has been released, certainly at the federal level with respect to COVID, have been guidelines, not actual enforceable standards, right? So on the point of enforceable standards, what we have are still at the federal level. We have OSHA, Occupational Safety and Health Administration, enforce the Occupational Safety and Health Act. So we have OSHA standards, for general industry, for construction industry. There's also the, within that, there are states who have OSHA approved state plans, right? And then there are, in addition to OSHA, also the federal level, depending on your industry, there's the Mine Safety and Health Administration as well. So they obviously, as the name suggests, deal with mine safety, right? Now, it's also worthwhile to note at this point that, and this is a conversation we've been having at many levels, OSHA during this pandemic and in a lot of emergency situations is actually has really taken a step back from enforcement. They've been acting in more of what they call an advisory or guidance capacity. So they provide recommendations. They've been providing, again, guidelines for employers, recommendations for workplaces. But those guidelines, those recommendations are not regulations, they're not standards, they're not enforceable, right? They are just suggestions, and if employers implement them, great, and if employers don't implement them, they don't have to. So that's been happening, right? Now, the other thing to note is that OSHA also only covers private industry, so it doesn't apply to public healthcare workers, except for in those states that have Public Employee Safety and Health Administration, PESH, which New York State does, and that's done through New York State Department of Labor. So they enforce OSHA standards under New York State. So that brings us rather neatly to the New York State Department of Labor, and that is going to be my first link to you. So New York State Department of Labor has a safety and health department, and that is their link. So that is a resource that, again, this is operated at New York State level. They have standards, they have regulations, they have recommendations, they also have contact information for who to call in the event of blank. So that is there for you. Then at the local level, you really have to check with your municipality. NYCOSH works predominantly in New York City, so New York City is the local level that I'm most familiar with. But at within Long Island, at your local level, there are different agencies that may be applicable to your particular question. And then the other thing that I would point out is that depending on if you're working with specifically regulated materials, those have their own individual laws, right? So if you're coming in contact, for example, with asbestos, with lead, each one of those is regulated by a different regulation. By a different law. So you have to look up by the material. And if you have any questions, I can help you find where that is. It's not all of it. Not all of it is through federal or state agencies. Some of them are, just regulations that have been published at different levels. And the other thing I would point out is I've actually gotten a lot of mileage also out of specific building codes and fire department regulations. There are certificates of occupancy that different, for example, either fire department tends to write summons under. So those can be very useful guidelines as well. If you need, for example, that there is an issue of storing flammable materials, things like that, right? So they also can, when we're talking about, are there too many people in this area, that would be a certificate of occupancy question, okay? So that is in terms of the actual enforceable regulations. And then what I also tend to recommend on top of that are industry standards, right? So these tend to come from professional agencies, professional organizations that publish recommendations or publish guidelines on how to work in specific areas, what the procedures are for either working with some equipment or, again, specific industries. Now, they're not regulations, they're not standards, so they're not technically legally enforceable, but you can absolutely make the case that they are best practice in a particular industry, and so they should be followed for, in order to not be negligent or remiss in worker safety. So that is my answer to that.
Alexandra?
Okay, sorry, I have to unmute and mute. I'm doing this on my phone, but all right. So I think I just wanted to give a quick overview of like what the phased reopening is in New York, just so we can give this context. So as most of you probably know, the governor set out a 4-phase reopening process, and all regions in New York are in phase 1, including Long Island. New York City just came into phase 1, I think like 3 days ago or 4 days ago. So phase 1 businesses are construction, agriculture, retail, some retail, manufacturing, and wholesale trade. And what they've done is outline different standards of reopening. So all businesses are required to submit a plan, but once that plan is submitted for reopening, there's no mechanism where the governor's office is saying, okay, you're cleared to reopen, because there's, I guess, over 600,000 businesses that have to reopen. So you're not going to find that. But the governor's website does have specific guidelines for each industry. So the guidelines are basically broken down by like spacing, how much space needs to happen between individuals that are in the workplace, what PPE the employer has to provide these things to employees at no cost to the employee, cleaning and hygiene practices, communication practices. That includes informing workers about their rights in terms of safety standards, training for managers and employees. If an employee tests positive for COVID-19, the employer is required to notify the CDC. State and local health agencies also have to be notified. And workers who made contact with an employee who's tested positive also have to be notified. And I know that that's a concern for a lot of people going back to work, because they're wondering, well, if my coworker has it and the employer knows, are they going to tell me or not tell me because they want me to continue to go to work? So the employer does have to notify. There are also screening guidelines, mandatory screening assessments, questionnaires, temperature screenings, a 14-day quarantine required for employees who test positive. That's all in phase 1. And then in phase 2, so each phase, the businesses change. The kinds of businesses that can reopen change. The guidelines change a little bit because they are industry specific, and we'll spend all day talking about what the specific guidelines are. But there is a toolkit that you can go into to look, and that website, which I will be giving at the end of this, is forward.newyork.gov. That's the governor's website. Long Island is not yet in phase 2, but there are a bunch of regions, including Western New York and the Capital Region, which are entering tomorrow. And there are a few regions in the state that are already in phase 2. But the phase 2 businesses are offices, retail, different retail, vehicles, vehicle sale, rental, lease. And again, those things vary by industry, and the guidelines are relate to spacing, PPE, cleaning and hygiene, communication and screening. Phase 3 includes restaurant and food service. There's no region that's in phase 3 yet. And phase 4 includes arts, entertainment, recreation, and education. And of course, there's no region in phase 4 yet. As far as what you can do if you see violations, in addition to the things that Marina mentioned, at first, I think there was a mechanism on the website to generate or to make complaints. I wasn't able to find a complaint on the governor's website, but they do they are funneling or directing people to state local agencies, local enforcement agencies. So in Nassau County, we have the Nassau County Department of Health. There is a coronavirus hotline, which is 888-364-3065. And I'll put these up on the Hofstra website too. So there's also a Suffolk County Department of Health, and they have their emergency numbers and public hotline numbers for each. And the question is really open-ended as to what are we going to do when there's violations? I don't think that really any of us know, but I don't think that the local police are the mechanism for enforcing workplace violations. I think it's the department.
Lovely sound of children. So I don't know, Nikki, did you also want to talk about what do we do if we notice that safety standards are being violated by employers or coworkers? Or I know in retail and other industries, we're also worried about customers, right? Or the public violating these standards. So what can we do if we notice violations? Where do we go?
I think in terms of the public, right, this is one of those, there unfortunately have been an incredible amount of gray areas. And I think this is one of those gray areas where the expectation, and there have been executive orders requiring the public wear masks if they're unable to do social distancing. But there's really no enforcement mechanisms. It's put on the individual business to enforce those social distancing protocols, wearing masks, which is a little bit troublesome for us because oftentimes it means a worker, whether it's somebody in the store or work site or the manager even, right, that's potentially putting them in a situation where they could be in an altercation that's problematic. So I think in terms of the public, this is there's no unfortunate reporting mechanism, but there's this one of those opportunities where it's really important to have a robust education campaign so people know that you shouldn't be letting your guard down, and that we have to continue to do our parts. I think Marina and Alex answered the questions in terms of where people can go. I think, but ultimately this is also one of those situations where having union representation makes a very large difference, because there is, under a collective bargaining agreement, there is a layer of enforcement. So if somebody's not getting proper PPEs, there's a collective bargaining agreement in place. A worker has a place where they can go, call their union representative, and get that addressed in, almost immediately. So this is one of those situations where the power of a union really does make a difference, and it has made a difference.
Thanks. Thank you, Nikki. Alexandra, I remember when we were doing the planning session for this, we talked also a little bit about the private property, right? And if you go into a business and other patrons of the business are not following safety protocol, that the owner of the business actually has recourse. And I wondered if you wanted to expand on that.
Sure. So, in the governor's, guidance on this, it specifically says that, a property owner has the right to, prevent anybody that's not wearing a mask from going into the business. But if you've ever seen an owner of a business has the right to prevent people from going into the business so long as it's not a constitutional issue, I guess. But as far as if you are told that you have to leave a business and refuse to do so, it's a trespass. So, business owners have the same right to prevent trespass as they always have, and particularly now. So if there's a customer who wants to come into the business and refuses to wear a mask, the employer or the business owner has an absolute right to prevent that person from coming into the business. And then that's a situation, if a trespass has occurred, that's somebody that's in a place that they've been told they're not supposed to be, then there's law enforcement that has to, the business owner has to call law enforcement.
Okay. Anyone else want to add any other information to that from our panel? All right. Okay, great, thanks. So we're talking about sort of what you do if there's bad stuff happening, but one of the things we wanted to share with people is that there are some places where enforcement is going well, and there are some best practices out there that we could model in our own workplaces or advocate for. So I was wondering, Nikki, if you wanted to share some of the best practices that you've seen in your organizing efforts with Local 338.
Yeah, absolutely. So I think obviously because it is, it's mandated under executive orders that employers have to provide appropriate PPE. So obviously that's, ground zero, number one, making sure that people have the tools they need to do their job safely and effectively, minimizing risk. But other things that have really helped in work sites, particularly where there is a one-on-one interaction with the general public, is plexiglass windows being installed. So there'll be these pieces of plexiglass. I'm sure everyone's seen them here at their local supermarket. Pretty much at any point of interaction between the public and the worker where there's a transaction. They've been implemented in Starbucks. It's pretty much become standard practice. I've seen scopes of what that's going to look like in office environments to kind of help separate out cubicles. There's been some photos on the internet around what that looks like in terms of beauty salons. So those plexiglass windows do help quite a bit. Additionally, there have been a number of social distancing protocols implemented that in retail, which is a little bit easier in kind of a setting like that, where you have one-way aisles, the floors have been marked to highlight really where to stand. That's 6 feet away. Also limiting the amount of people who are entering a facility. So, whether it's a retail space, limiting the amount of people in there, but also in terms of office settings where people are still doing staggered shifts in, for example, even like a medical cannabis section, people are doing team A's and team B's. So some people work 3 days on, then they're off 3 days, and it rotates to really ensure that there's minimal risk and exposure. So those have been some of the things we've seen. We've also seen regular cleaning. That's something that quite honestly should always happen, but that's something that's really been stepped up, where there's thorough cleanings done at night to ensure that everything's properly sanitized and every surface has been wiped down. So that's something also to think through, is ensuring that those proper cleaning protocols are happening. I believe the CDC, I can look for that information. That is, there are products that can be used, that are recommended to use, that actually do kill viruses. So those are some of the key things that can be done. I know I just saw a question pop up about students and teachers and school environments. I think that is something that is still being talked about and worked through. I've talked to a couple of teachers and obviously professors in higher education facilities. And I think my understanding is that's something that's still being worked through, because it is harder to do social distancing in a school or academic setting. The governor just announced that day camps can open at the end of June. So my expectation is that there's going to be guidance continuing to come, because this is an ever evolving situation. And, my best practices are, really related to where my members are, which is healthcare, human services, retail. So I defer to somebody like Marina, who has much more experience in environments outside of my own. So I don't know, Marina, if you were planning to talk next, but she has, she can probably speak to education settings much better than I could.
Marina?
Sure, thank you, Nikki. So I actually do end up working with schools quite a bit. And we haven't worked out any specific details, but I am in the process of talking to schools about, well, great, what are we going to do in September if we're doing anything in September? So that very much is still in progress. What I am going to share in the chat right now is a link to an overview to the hierarchy of controls, which is kind of like the mind frame that I would recommend we approach workplace reconfiguration from. And the idea here basically is that, yeah, you know, in an ideal, how this conversation started, you know, at the beginning of the pandemic is we need masks, we need gloves, we need all this personal protective equipment, and that is definitely useful and important and effective. But also, you know, if we start a little bit higher up in the hierarchy, we want to, you know, personal protective equipment is something that you put on when you know that you are going to be exposed to some kind of hazard and you want to, you know, do your best. It's your last resort for prevention from, you know, becoming ill or injured when you already are going to be exposed to a hazard. But I would say a better idea, a better preventative measure is to not become exposed to the hazard in the first place. So when we're talking about how do we mitigate our exposure, how do we mitigate becoming injured or ill in the workplace, the idea behind the hierarchy is you start higher. So, you know, do you have to wear personal protective equipment, or can you maybe install ventilation? Maybe can you install those plexiglass barriers, right? That would be your engineering way of changing the workplace itself, right? So that would be where I would start. With, you know, how this works in schools, well, in an ideal world, you would limit the size of the classrooms, right? So you could do that, have the same size room, fewer desks, fewer students, have people sit further apart, right? You would have to change if you are doing, if you're used to doing group work, your group work is going to look very different, or you're not going to have group work, right? You might be, maybe use more technology, different tools that would, instead of having people, let's say, sit together or, you know, share physical materials, you would have people communicate digitally. Things like that, right? Are they perfect? Not really. Are they going to change the way that, you know, that education looks like? Absolutely. So, but they are ways that we can explore of doing this in a school setting. The other thing I want to share in terms of not specific to school, but a protocol from Santa Clara that actually we are using in NYCOSH internally to help model our own back to, you know, when we do come back to the office, what we're going to do, what it's going to look like. So I'm sharing that in the chat now. And that, I've looked through a bunch of these at this point, and this is actually my personal favorite, because it goes through all the types of details of what kind of signage do we need to put in, you know, to use to remind people what we're meant to be doing now, right? Are we going to train our staff? Absolutely, we're going to train our staff on what that training would look like. What can we do, you know, what do we need to provide in the workplace setting? Do we need to make more hand washing stations, etc., right? So this is a pretty good, thorough checklist that Santa Clara County has developed and NYCOSH is using, and I recommend to anyone and everyone.
So that's really, go ahead. I'm sorry. I thought I don't want to cut you off.
Thank you. No, I just actually saw a question in the chat about plexiglass barriers being insufficient. So yeah, there are studies that I've seen that that have measured that depending, you know, like if you have a plexiglass barrier between two people, the nature of fluid dynamics is such that if someone sneezes, the droplets would still travel around the barrier itself. So that absolutely is a valid point to raise. The thing that, so there's two parts to this answer, right? One is that a lot of this research is still in progress, and there is unfortunately a lot of information that we don't yet know about how this travels. You know, there's not even, like, people have been studying fluid dynamics for actual decades, and we're still getting new studies now about, with as imaging improves, we're able to see droplets that we weren't able to see before, and now it's changing our understanding of how all of this transmission is happening. So there's definitely that, and it's difficult to account for that. But in terms, so, you know, as a safer practice, what I would recommend, what I intend to do personally for myself, and what I would recommend to, you know, in our office and everybody we talk to is, yeah, if we use the plexiglass barriers, that's great. But frankly, at this point, I would keep a mask on, partially because, yes, you know, fluid dynamics being what they are, you might get that droplet transfer, but also you're not always standing behind that barrier, right? You're going to go to the restroom, you're going to go wash your hands somewhere. And the thing is, best practice for wearing a mask is you put it on with clean hands when you start the day, and then when you take it off, your hands better be clean, and then you wash your hands afterward and you don't handle the mask. So if you're wearing the mask to travel to work, then you keep that mask on until you either need to take it off to eat or what have you, but you need to have washed your hands beforehand. So if you're starting the day with the mask, don't take it off just because you're now walking behind a barrier, because now you can have contamination. And, you know, if you're trying to take the mask off with dirty hands, that has its own problems. So just for best practice, once your PPE is on, until you need to change or take it off, keep it on anyway. So that will be my piece on that. Thank you.
Thanks, Nikki. Alexandra, did you want to add anything?
Yeah, so I think the most important thing that workers should know is that they have a right to make complaints about the safety precautions being taken at work, and that they cannot be terminated for this. Now, I recognize, you know, that there's a difference between an employer that follows the law and you know what the law says, and then what reality is. So I know that and I have clients who have made safety complaints to their employers, raised concerns about the availability of PPE, the practices for cleaning and sanitizing, things like that, and have been terminated for the pandemic right after. So, you know, so I think that this is the purpose of collective action, right? So workers, even if you don't have a union in your workplace, it is also illegal to terminate somebody or to punish an employee in some way, demotion, all kinds of ways that an employee can be punished, transfers, things like that, for making complaints on behalf of a group of workers. That's two workers at least. So if you make a complaint and say, hey, look, me and this person are concerned about this hazard in the workplace, it's illegal to be terminated because of that. Now, you know, we all know what goes on, and so I say that it's illegal with, you know, that there are things you can do about that termination after, but it is important and probably really helpful to take action in the collective when it comes to protecting yourselves and protecting yourselves at work. You don't really want to leave it to your employer to make sure that you're safe. You have to take the onus a little bit on yourself, because, you know, who's more responsible for your health than you, and you're going home to your family. So there's that piece. And then I would say, you know, that collaborations between employees in management and unions in management. There are some workplaces that are structured where the employer functions as a supervisor in the workforce. And there are some employers that function where the employer is disconnected from the workforce. So particularly for employers that are disconnected from the workforce, it's really, really important that employees are having open dialogue with their employers about what's actually going on, what hazards they're observing, and figuring out better ways to, you know, to have this collaboration between management and worker to have, you know, to address worker safety issues.
Okay, great. We do have a question in the chat that I think is related specifically to this topic. So I'm gonna ask it now. It comes from Nora. Will employees screen with temperature checks at the beginning and ending of shift? Marina, I wanted to toss that to you. Is that part of the standards?
There is the recommendation. It's to say it's part of a standard is a little bit tricky, because, you know, what standard? But there are definitely recommendations made that employers conduct temperature checks, both of the employees, and if the workplace deals with any people who are coming in, then That's a recommendation that's been made, and that's something that different workplaces are doing. There are points that I think it's important to raise and to note with that, is that, first of all, if screening is being done, right, there are privacy issues, privacy concerns at play, right? Who's doing the screening? Who's keeping that information? How is that information being used and shared? Secondly is more on the practical side of who's conducting the screening and what tools are they using? Are they using a thermometer that requires physical contact? If yes, how is that thermometer being disinfected between people who are being checked? Are they using an IR gun that, you know, that scans someone's like surface, you know, forehead temperature? What is the accuracy of that tool? Third is, who, you know, are people, well, third, what I would say is not everybody who is ill has symptoms. So there's that thing to consider. Yes, this will filter, or rather this will catch people who do have fevers, who do have visible symptoms, but it is, you know, there could be a false sense of security that, okay, I don't have symptoms, so therefore I'm definitely not sick, I'm fine. And then if that's the mentality, then are those people more likely to, or rather less likely to follow other safety protocols because there's the potentially false supposition that they are perfectly healthy. So those would be my concerns with temperature screenings.
Okay, we're getting a bunch of questions that I will address when we get to the Q&A part. Some really good questions, just so we make sure to get through all the questions.
Marianne, I'm sorry, I just wanted to add something.
Yeah.
You know, in the phased reopening guidelines, to the question about screening and temperature screening specifically, some of the specific industries, there are requirements that the employer have a plan in place, particularly in manufacturing, where temperature screenings are part of the guideline. And so, you know, in the phased reopening plan, every industry is different, so that there are some industries that is required. And I can also say anecdotally, I know for the childcare businesses that are opening, they are doing temperature screening on parents and children every single day.
Wow. Okay, wow. So a question adding to the enforcement of standards. Do you have recommendations? And I'm going to ask Alexandra first, and then Marina, and then the other panelists can jump in. Do you have recommendations for policies that we could and should be advocating for to keep us safe in the workplace, specifically related to COVID, but if there are others that are out there that you think we should? I mean, we've talked about voting, right? But there's more to, we're voting for candidates, but are there policies that we should be, you know, voting for while we're at it?
Yeah, I mean, you know, not just as a mom, but as a worker, I think that one of the major gaps here is what are we doing about childcare? And that is going to be, I think, one of the biggest questions that we have to answer when we talk about reopening and creating a more just economy, because all that's going to happen if we don't address the childcare problem is that we're going to push women out of the workforce, particularly women of color, and we're not getting to the root of the problem. So there's all these different layers of reopening the economy, but we have schools that are closed, which boxes a lot of people, particularly women, out of the workforce. So if, you know, the phased reopening is great, but, you know, how are we supporting childcare facilities? How are we supporting, you know, unemployed people to be able to look for work? You can't do that without childcare. You really can't do anything without childcare. So I think that talking about childcare and working on how we're going to fix, you know, a lot of daycare centers, or most daycare centers, are small businesses, privately owned, have closed permanently. And so I think that that's something that we really, really need to be looking at policy-wise.
And we happen to have a forum dedicated to that, which should be, I think, very enlightening and interesting. Other panelists, Marina, are there health and safety policies that you would encourage us to ask our electeds to advocate for?
Well, we don't have an infectious disease standard or infectious disease policy, all right, can everybody hear me? Because I'm getting a thing that I'm muted. Yes,
Yeah, we can hear you.
Thank you. Okay, cool, thank you. So infectious disease policy at this point is something we don't have at federal level or really at a state level. So that would be something that we've absolutely been talking about at NYCOSH. I absolutely second the what are we going to do about childcare conversations, and I tend to take a broad view of health and safety. Right? Traditionally, you wouldn't say that childcare is a health and safety issue, but what we definitely see in worldwide is that where there's not a reliable childcare policy, people tend to bring their children to work, and that's how you get young children who start doing who are essentially entering the labor force in the single digits of their age-wise. So that's a policy. Also, sick leave, paid time off leave, family leave. Those are absolutely crucial things because, it's not just children that require our attention. It's also if we have older sick family members or even younger sick family members, whatever person that you live with or live near that requires some kind of attention that can't be provided outside of your work hours, if you don't have a policy to address that, then you are also pushing people out of the workforce, or you're pushing people into dire financial circumstances because they end up taking unpaid leave or losing their jobs because they can't stay in. So all those related policies are absolutely necessary.
Nikki, anything on the union front, policies out there on the horizon that would make it make for safer workplaces for working people?
Obviously, anything that supports the ease to unionize. So the PRO Act, which passed the House of Representatives, which would make it much easier to join a union. But I think also we fundamentally have to think through what's happening in terms of workers' compensation as well. Obviously we're reopening, but we also have to think about the people who have been on the front lines for the last 11 weeks, whether you're working in a hospital, a nursing home, a retail facility, working as a delivery driver. And I think part of this conversation is workers' compensation, because I think, as Marina said, we're still learning so much about this disease, this virus, and the way it impacts human beings, right? And our bodies. So there's the real concern about, making sure that people who got sick are able to, particularly at work, which is part of the problem. The guidelines are incredibly difficult to access workers' compensation benefits. You have to essentially bring the person with you and say, this is who I got COVID from. And if you're working in retail or in healthcare, you can see hundreds of people at a time. But also recognizing that there are going to be long-term implications of this virus on people's physical health, because we don't know. People it's attacking their kidneys, their liver, people are having strokes. There are all sorts of things that are impacting people, and we have to start talking through what we're going to do to support those workers long-term who might have a long-term health implication because of it that might not appear right now, but it might happen in 5 years from now. And that's some policy we need to talk through. And I don't pretend to have a silver bullet on what that looks like, but that's something we need to talk about. There are plans, or there's legislation around creating a benefit fund for those who pass away, to support the families of workers who have gotten sick and succumbed to the virus. So it's not necessarily directly to workplace health and safety, but we also have to make sure when people are outside of their workplace, they also feel supported And we're compensating people who have worked very hard for the last 11 weeks and risked themselves and their families as well.
Thanks, Nikki. I know everyone's concerned about physical health and well-being, and with very good reason. But one of the things that we wanted to address here also is issues of mental health. And so I was wondering, Nikki, Marina, as someone who deals with health issues in the workplace generally, can you tell us what kinds of things working people can do to protect our mental health with all the stress and anxiety about COVID that's out there, the helplessness that people feel, suggestions or resources that you have for us?
I can, in fact. Thank you so much. So what we've been suggesting is disaster resiliency and disaster resiliency training. And just to, I know I sometimes use very industry type terms. So disaster resiliency in general terms is just the way that we can, as individuals, as communities, as organizations, practice adapting to and recovering from hazards, from stressors, from these life-changing events. And so there are actually resources in New York State and elsewhere that provide resiliency training. I would be remiss if I didn't tell you that NYCOSH is one of them. I think my ED might have my head if I didn't mention NYCOSH absolutely provides resiliency training, totally free of charge. I'll leave you my email address so you can do that. But also at a state level, there are some resources I found. There are the New York State Office of Victim Services offers, at this point they have free recordings of the resiliency trainings that they have conducted virtually. School Mental Health Resource Training Center also has trainings that you can take at your own time. They're online trainings. You can log in when you have a chance, and you'll do your module, pause wherever you need to pause, come back to it. And the New York State Trauma Informed Network also has trainings that you can do virtually. So I am going to put those in the chat right now. And then the New York State Trauma Informed Network also has a host of other resources that you can use, again, at your leisure. And they are on an absolute variety of topics. So I can't recommend these enough. And if you need more, I'm happy to help you find whatever it is you're looking for. So,
Nikki?
Another union, benefit of being a union member too is, so for Local 338, our members have access to a member assistance program, and a number of unions also have access to a labor assistance program. Many employers have EAP programs so that people have the ability to turn to somebody if they need to talk through how they're feeling, and get some support and help that they need. In talking to some colleagues who are clinicians who do social work for a living, one of the things that they have really helped me grapple with too is recognizing that if in a lot of cases, if we remove the stressor from somebody, a lot of the trauma and emotions that they're feeling kind of are minimized, right? So for example, childcare is one of those issues where you help someone find childcare that they know their little one is safe and is a reliable place. Some of that overwhelming sensation might be removed, right? But there are other things too. I think some of the calls we've gotten from our members very early on were related to some of those basic safety things, and even now, right? New York, I live in Queens, and our members live and work in the city too, so they're under a curfew, and it's as essential workers, it's what does this mean, right? So we're helping people understand how to get to work, to and from work safely, and that removes some of the stress that they're under, making sure that they have proper PPEs, making them feel safe in their working environment will remove some of that stress, and just talking them through how to navigate some of those issues will really help. And obviously there are people where what's happening in the world, whether we're talking about, COVID-19 or people who are being assaulted because of who they are and what they look like, right? There's a lot that is triggering and traumatizing. So getting people that help, but also recognizing that there are some underlying factors. Dealing with the stress of trying to file for unemployment, right? Helping people through that will help minimize some of the emotional and mental strain that they're under. So it's really helping people get to the root of what is causing them that great anxiety or stress.
Thanks, Nikki. Thanks very much for that. So the last question that I'm going to ask before I go to the chat. Oh yeah, Annie.
Yeah, if I could just jump in. I'm sorry. I'm equally as bad at jumping in on Zoom calls as I am on conference calls. So I actually wanted to just backtrack a little bit. It is related to string a little response from the last question on policy in with this, but I just want to just thank Nikki for injecting a piece on trauma and ongoing stressors and how important that is. And I feel like as a society, we tend to see mental health as this individual responsibility that we need to take care of, and we don't really see the systemic impacts on mental health. And I think that this pandemic is a great opportunity for us to actually begin to see the ways in which a lot of these larger social and economic issues and inequities are very much related to mental health. A way in which stagnant wages are the root cause of mental health, because if you do not have a family sustaining wage or a living wage, that's going to cause a lot of other ripple effects in your life. So I think that we need to have a much more holistic look at the way in which mental health is being addressed, especially from this. And then to sort of go back into the previous question on policies, I think all of the recommendations that people gave were really fantastic. But what I would say is that I encourage everybody to not only see policy changes as immediate policy changes right now, but that we really think into the future about some of these things, because we know that once this pandemic is sort of hopefully wrapped up in some shape or another, there's going to be long-term effects of these, especially for working class individuals who are likely going to see impacts of this and recovery from this for many, many, many years. So in terms of policy recommendations, I would say that we should also be thinking about single payer healthcare in New York State, health insurance for all. That is super critical. I think that we also need to be looking at the ways in which our local governments are going to be looking at their budgets in 2021 and where money is going to be allocated and what programs money is going to be allocated for, because local governments are going to feel the pinch as well. And as we always see, the places that get the cuts are always the ones that need it the most, like mental health services, like childcare, like arts, and all the things that sort of keep our mental health running and our families going in these stressful times. So we should also be very much involved in seeing where monies are being allocated in the future, so that these very critical programs that people are going to need in their ongoing recovery from this pandemic will be addressed. So just wanted to add that in there.
It's terrific. Thank you. I second everything you said. So our final question is addressed to Ani and Nikki. And it's Ani, I think if you would go first, because it really links to what you said, and then we'll open it up and I'll go to the chat and we'll look at some of the questions that we haven't yet gotten to. So every crisis presents an opportunity to change the way we do things, and I think Nikki, Ani, you've started addressing that. But I want to pose the question directly to you and to Nikki as an organizer. What opportunities for organizing and building worker power do you see arising from this crisis?
Yeah. So before I give an answer, I just want to say that give a huge shout out to the unions for really holding it down for workers through all of this. I mean, they really are on the front lines of ensuring that worker protections are maintained. And I think that one really great organizing opportunity here for the labor movement is the ways in which we're looking at collective bargaining in the future. And what we're actually bargaining for in agreements moving forward. And I think that learning from the pandemic and the impacts of the pandemic and the ways in which they're deeply affecting our communities in economic ways, we need to really be broadening the ways in which we're collectively bargaining and looking at the ways in which those what we're bargaining for in those agreements are not just related to what workers are going through on the job, but what is happening in their communities as well. And if there are ways in which we can inject all types of economic recovery into those collective bargaining agreements, I think that that is a really wonderful way to move forward. I also see this as an opportunity for unionized and non-unionized workers to really come together and bridge together, because right now this pandemic is revealing that, not only has this pandemic put health and safety at the center stage, but it's also showing that workers are fighting for the same protections, whether you're unionized or not at this point. It's about health and safety. It's about having protective equipment. It's about having hazard pay. It's about looking at the ways in which paid sick leave is implemented. So I think that seeing that bridge and finding ways in which we're connecting the workforce together is really critical. I also find that, and perhaps this is the conspiracy theorist in me, and I feel like all of us activists have a little bit of conspiracy theory in us because we see this so much, but I find that in these moments of crisis is exactly when the corporate powers that be are going to jump in and find a way to make even more money than ever before. And I think we've seen that already, that while the working class and the middle class are struggling right now, the wealthy, the 1%, the billionaires and the corporate CEOs and tycoons are actually making a profit right now. And if we really want to talk about looting, I think we need to look at the fact that corporations have been looting our people for centuries and centuries. So I think we really need to look at the ways in which, there's been a consolidation of wealth and an increase in corporate influence in this particular crisis at hand. And we need to be able to break that down and get rid of that, because it is only going to get worse if we can't see through that. I also think that, if we sort of, just going back to OSHA really quick, because I think it's sort of interesting, because the labor movement was at the forefront of the creation of OSHA back in the early 1970s. But right now, I really do think that we need to be thinking beyond regulatory reforms like OSHA, because we see the ways in which OSHA can be quite problematic in a moment like this. So we need to go beyond that. And I think we really need to look at the ways in which we're increasing worker power and capacity. Specifically through unionization. I think that there's a really critical moment that the labor movement plays right now moving forward. We've seen a historical decline of workers unionizing, and I think we need to be able to flip that right now, because if we're not doing it now, I'm not sure when we really can. I also feel like we need to be building more political vehicles for working class people to have a voice in the system. And we need to create these vehicles so that workers can exert more political power in decisions that are made. And we definitely need to have more democratic control over production and the ways in which corporations are driving their profits. If we look at it like what's happening right now on the federal level, and it's a really tricky position because we want our states to act. But right now, there's also a really large role that the federal government is playing. And with the administration that we have right now, it seems as though we're actually giving corporations more of an opportunity to be bad actors. Because right now, there's even question of whether they're going to be held liable for any types of deaths or any types of things that are happening within their places of employment. And that is extremely problematic. Now is not the time for us to be letting the employers and the corporations off the hook. If anything, now is the time for us to really be having strong enforcement mechanisms for when workers are going back to the workplace. And then the last thing I want to say is really, I want to go back to what I opened with, which is, I think the ripe organizing moment here is recognizing that we are all deeply connected, and that this isn't just a workers' rights issue. This is also a issue of healthcare. This is an issue of racial justice. This is an issue of environmental justice. And if we are not piecing the intersections of all of these injustices together and really trying to figure out a way in which we are holding corporations and this administration accountable to what is happening, it's going to be devastating in the future. So I just threw a lot out there, but really I would like to say is that we really need to shift the ways in which these corporations are running this country, and we really need to be able to call out any of our elected officials who continue to take the money from these corporations and continue to allow themselves to be bought out by the corporations, because at the end of the day, they're really harming their constituents when they're doing that.
Thank you, Ani. Nikki, opportunities?
I just want to start by saying Ani is a really hard act to follow. I'm gonna take because I work on staff of a union, so I'm gonna do kind of two tracks here. One being, I think for us, it's an opportunity for internal organizing of our own existing membership in a way that I think we always do and is important to us, but it's taken on maybe a new vibrancy and energy that wasn't there 6 months ago, frankly. Because in talking to my members, I've heard a change in tone, right? Even from the start of the pandemic, right? I said earlier that being an essential worker right now is incredibly sexy. Everyone wants to hear about their experiences. It's very, very interesting to see how overnight a switch flipped, and suddenly people who have always been essential to our economy are finally getting the spotlight and recognition that they should have had a long time ago. And in talking to my members, one of the things that struck me that they would say was, yeah, sure, I'm on the front lines, but you can never compare me to the nurses and the doctors and all the healthcare professionals who are doing amazing things right now, right? There was this kind of weird, they were creating a hierarchy internally for themselves. But since then, including, I think everyone now knowing somebody who might have gotten sick, that narrative's changed, where they're starting to take ownership of, like, I'm important. We're part of the reason why communities were able to remain operational. Without us, all would have been lost. And so I think workers who, whether you're a transit worker or you're working in a pharmacy, there's this new sense of recognition about how valuable they are, not just as workers, but to the places where they work, to the communities they serve. And so I think that internal recognition is going to motivate people who may not have necessarily gotten involved in their work site, or who might not necessarily have shown up to help get out the vote or for a lobby day. They might be more energized to do so because they're empowered. They feel empowered. People are paying attention to them. People are buying them pizza at their work site, right? And that's totally non-consequential, but for somebody that makes them feel important and recognized and heard. The other part of this, I think, is, I'm sure everyone here, their neighborhoods light up at 7 p.m. That's still going on, right? And I think, and I hope, right, that now the public is more aware of what workers go through, right? When was the last time you heard about what happens in a meatpacking plant, right? Those conditions are not new necessarily. It's just we added in a, highly infectious disease to that, right? But there have always been problems in meatpacking plants. Speed lines have always been a conversation of speeding them up and the impact that has on worker health and safety, right? So now all of a sudden people are talking about meatpacking plants, right? They're talking about, making sure grocery workers have PPEs. So I think now that there's an informed public, and I would even say in terms of what's happening with Black Lives Matter, I'm seeing people on social media who I didn't even know they knew what the movement was, are suddenly being more vocal about their support and recognizing their privilege. So I think we have a public that is ripe to be supportive of workers and help move that conversation, and who, when there's a picket line in front of a work site, might actually stop and talk to the workers and show up and help. He may not hand out flyers and be there for a long time, but they might call that company and say, what you're doing is disgusting and reprehensible. And I'm very hopeful that this public who's like newly energized and newly aware, or maybe they've always been aware, but finally feel like I've had enough. I can't take this anymore. I'm tired of hearing about disgusting things happening at Amazon warehouses. I want to do something, are going to come out, you know, when we're allowed out in, you know, the next couple of phases. I'm in the city, so I haven't gotten to that phase yet. And I also questionably will not be allowed out later. So I think we're in a really interesting spot where workers feel empowered, but the public feels empowered also to support them.
So it sounds like a moment for big ideas. Let's hope that we get some leadership and big ideas and we, you know, and grassroots activism. So that's terrific. And so you can see why this is just such a great group of people. I love working with you. I'm going to go back to the questions because we have not much time left. But I just, if you have a question, can you please submit it? Can we get the link sent to us after the webinar? We will try to do that. I'm going to save this chat and see if we can address everything there. But I also encourage people, please go to give it a day or so, and then hofstra.edu/labor studies, and we will try to have all of the resources. All right, let me see. Local authorities are identified as having a frontline role in responding to alleged violations of reopening protocols. Who are they, and what power do they have to punish violations? I don't know. Alex, did you want to?
Yeah, sure. So the answer to this, so the local, you know, enforcement mechanism appears to be the local Department of Health. So as I said earlier, that would be the Nassau County Department of Health and the Suffolk County Department of Health. What they can do about it is unclear. We've never really had this kind of thing before, so we just don't know. I don't know as an attorney what people can really do. There might be a way to shut down some of these workplaces that are just, you know, brazenly violating the safety standards. There might be fines, but it's a little bit unclear. What I can say, and this I'm just going to reiterate, I did say this earlier, but businesses do not need to reapply for the right to open. It's that is self-policing, which is a little bit of a problem. But there's no way for New York State to go through an application process where everybody says, oh, I did these things. Okay, you have the go ahead. So employers are submitting their plans to the state, but what is happening with those plans, it's unclear.
Okay, so we have a question here from Anissa Moore. Who's financially responsible for implementing these kinds of protocols? In the case of education, and this is an educator, is this the educational institution or the county or the state? Anyone? Do we know? Marina, is that a?
So I'm actually a little bit, to be honest, unclear about about the question, like fiscally responsible for which part. Is it the taking on the financial challenges of we are going to maybe have to reconfigure our workplace to, install whatever the engineering measures, do the ventilation, do the plexiglass. That tends to fall under the employer. If the state decides at one point to, to provide, let's say, some kind of grant money for employers to apply for to offset the costs, that might come down the line. But at this point, whatever the, if I'm understanding the question correctly, and if the question is who's paying for whatever changes the employers are going to have to make, that's going to be the employer, the business owner, whoever is in charge of that.
Okay, another question we have from Joyce is, would you need to be tested? And I guess I would say, could there be a requirement that a person be tested before they're allowed to go back to work?
I mean, I will hop in there and say, if we had the actual physical capacity and had the test themselves, right? Because again, we're still in a point where there is a shortage of the tests that we can use to, to test people. The other problem is that you're going to run into is the accuracy of the tests, right? There are, we've been hearing, both from an anecdotal point of view, from healthcare workers that we know, we've been hearing stories of the patient has all the symptoms and the healthcare worker is absolutely certain that the patient has COVID-19, but the test says negative, and they do the same test over and over again 6 times, and then on the 6th time you get a positive. So there is an accuracy problem with the test. These things are not perfect. And then there's the availability of the tests themselves, which is also problematic. So sure, in an ideal world, absolutely everybody would be tested, but on a practical standpoint, I don't really see that happening in any kind of organized or uniform fashion.
We have a question from Kelly, who says, why is it necessary for office workers at a university to wait until phase 4 to return to work instead of coming back at the earlier phase when administrative services can return? Nobody knows. Sorry, Kelly. Okay. So we have a question. Should all students and staff personnel in a public school building wear masks?
That's me, right? So all right. Here's the thing, right? As with, we're still learning a lot about the virus and disease themselves. We're also still learning about our, when we talk about masks, right? I know we're short on time. When we talk about masks, that generally means the surgical masks, the cloth masks. So we certainly didn't have before this a whole lot of data about how effective those masks actually are. So the sort of accepted thing is, yes, we should be wearing them because at the very least, when you wear a mask, that limits how far you're spreading your own respiratory droplets. So if everyone is wearing a mask, then great, everyone's sort of limiting the spread. And that way, when you're just having a casual conversation with somebody, you're less likely to infect them, and they're less likely to infect you if you're both wearing masks. So, from an overabundance of caution, until we know more, I personally follow the precautionary principle, which says that, yeah, we don't have all the information, all the data, all the things we should know. So let's be more cautious than maybe we need to be. So yeah, by all means, let's all wear masks. I wear a mask every time I go pick up the mail.
The final question from Georgette, and we have just a very brief time. My workplace has employed industrial hygienists to clean the college. How does that help when we get back? How often would the cleaning be required to keep faculty and students safe?
All right. So I don't know what hygienists are being employed. I, as an industrial hygienist, don't clean anything. I kind of just make suggestions about that. There, you should do that. So I'm not, industrial hygienists are not actually the people who do the cleaning themselves. If you are maybe talking about housekeeping staff or people who do disinfection services, that could well be. In terms of how does that help when we get back? Well, awesome, thank you. So really, at this point, cleaning and disinfection is something that should have always been done regularly. The kind of amazing thing with COVID-19 is it's shed light on stuff we should have been doing already to begin with, but clearly haven't been. So there should have been periodic and regular cleaning and disinfection all the time. So now we're just being more diligent about it. So in terms of what the cleaning is, right, that really I would suggest find out what the protocol is and what they're doing and what they're doing it with and when they're doing it, right? Because the idea here is, if we're talking about there's a possibility of transmitting, infected person touches a surface, that surface now has live virus. Healthy person touches same surface, picks up virus on their hand, touches their face, hello infection, right? That's basically how it works. So if we're talking about where cleaning and disinfecting that surface, you're killing, right? So you're killing the virus there, and that's preventing transmission. So if we're talking about, regular disinfection, the idea there is you are periodically cleaning the live virus off the surface. So in terms of how that's helping, then that is the transmission point that the disinfection is meant to break. I hope that I have answered that question. I'm trying to do this very quickly because I know we're a little over time. But basically that's the point. In terms of how often the cleaning is, a lot of places tend to do it. And I don't remember, I think Nikki has mentioned this before. A lot of the cleaning disinfection is being done either overnight during the office off hours so that surfaces are now, clean for the next morning's shift. What I know some offices are doing actually, or some workplaces are doing, is they're having their housekeeping staff come in more frequently. So instead of cleaning, during just once overnight, they're having people coming every few hours just to wipe down light switches, doorknobs, etc. So that's another option. So that's why I say you really should find out what your workplace specific protocol is and how they're planning on carrying that out.
Okay, my final question is for Ani. Any plans to run for president?
I saw that comment, and no, I have no intentions of running for president. The job is a little bit too much for me to handle. I prefer to be on the ground, causing the commotion from the ground up. But I appreciate the call for action.
What I'm hearing is we should just do a write-in campaign.
Sure.
Okay, well, that's about all the time we have. I thank you so much to the panelists. Thank you again to Hofstra. Thank you to Greg DeFreitas. Thank you to everyone who came and asked a question. I will save the chat. I will work with Greg to make sure that these resources are available at the Hofstra, www.hofstra.edu/labor studies website. The next forum, July 7th at 2 o'clock, because where are we going to go? And the issue, we will be addressing issues around parenting, care work during the pandemic and all the associated issues, both, touching on working from home, going back to work with children, and the crisis in care work that's confronting us as individuals and as a community and a nation and a world, actually. So thank you very, very much. And everyone stay healthy, stay well, and solidarity.